Welcome back, everybody. Welcome back to BETJ's, My Two Cents. I'm Jennifer Lewis Hall, and joined once again by my great co-hosts, both Keith and Ryan, and a special guest, Dr. Sweeney, Monica Sweeney, healthcare advocate, professional, caring physician, and primary care physician. We can go down the list. This is an important segment because we're talking about preventative medicine. I first want to define what is preventative medicine. We throw that term out there, but what is it?
It's taking care of issues before they start is one, which involves screening. So we talk about secondary prevention. But the most important thing that we need to define is primary prevention. Screening is secondary. Primary prevention is living in a way that prevents us getting certain conditions. And I just want to give one statistic because I hate numbers.
No, please do.
Of the people who die before the age of 65, more than half of them die from things that could have been prevented if they'd lived their lives in a different way.
So give me an example.
Smoking.
Cigarette smoking.
Yeah.
Right, exactly.
Obesity is now
Diabetes.
fast on smoking.
Okay.
Then we talk about obesity. I call it a gateway disease now because it goes to obesity, to diabetes, to heart disease, and then the list goes on. So those are some of the biggies. What about arthritis? And if you talk about obesity, you can list, I'll make a list as long as your arm, of preventable diseases. So that's what prevention's about. Living your life in a way to prevent disease.
So how come more of us don't go, especially when it comes to certain groups in the American population? You know, oftentimes we'll see, you know, African Americans, and you know, you had a grandparent, you may have a brother, and you know, you'll say something's been troubling you, something's been hurting, and they won't go to the doctor.
It just seems like if we can't see it happening to us right there, then it's not a problem. Particularly in the black community, where I know that at least in my family, we weren't used to the idea of going to a doctor unless your arm is falling off, or you can't walk, or something like that. And it gets in your mind that, well, I've got a little thing wrong here, a little thing wrong there, I shouldn't go to the doctor. My mother used to always say, if you feel pain, that's a sign of something going wrong. Now that's the simplest thing in the world, right?
Wow.
But at the same time, a lot of us feel pain and we think, oh, walk it off.
Well,
No
I have
big
an
deal.
island family. My family's from the islands, and it was, you know, well, you can put like a cabbage leaf on it or something. It's like, what is
I
that?
have a cabbage leaf
No,
right here.
but seriously, it's like you have a fever, you know, you put a cabbage leaf on your back, and then you pull something out of the garden. Now, some of this stuff seemed to work. However,
Goose grease.
we have
goose
flipped the script. I run to the doctor with my kids, but it is true. I think culturally, you know, we've kind of learned you can doctor yourself up.
But what about the cost involved with this? I mean, there are a lot of people, I think 45 million Americans who do not have health insurance. Going to the doctor is a major expense. If you got to take care of paying your light bill, taking care of your other bills, keeping your house running, who has time to think about the doctor?
Well, that's one of the reasons. But there are many people who have coverage who still don't go.
Well, that's true too. Exactly.
So what is that?
What's
Is that
the
the fear of
explanation for
knowing?
that?
Is that denial?
It's the fear of knowing and denial, and culturally, he's already said it. And the worst people on the planet, I think, are black men when it comes to going
That's
to
so
the
true.
doctor.
All the black men in my family are the same way. Nobody goes to the doctor for any reason. I'm like the exception because I go to the doctor for anything. But everybody else, my father, my grandfather, great-grandfather, who I had the opportunity to know, nobody went to the doctor.
Yeah.
And even when they, as you were saying, Ryan, when it was so clearly they needed to go to the doctor, they just would not do so.
Right.
I think there is something, I don't know what it is about black men, but it's like we're socially
Part of
trained
machismo.
not to go to the doctor.
Isn't it also there's a mistrust there?
There is definitely
that
a
you're not going
distrust.
to either be treated fairly or can I trust you? I mean,
That's
you
right.
know, and I think certainly my husband wouldn't mind me saying this, is that when his own father had a stroke, it was, well, I'm not going to take this medicine. I don't know this woman coming into my house. I don't want the therapy. I don't trust you. And really his condition declined quickly, and it was sad to see.
Well, you know, Tuskegee has had lasting effect. And we can't talk about it as if it's ancient history because Tuskegee only ended in 1970.
Wow.
Now, so even though I sometimes get impatient with my patients, and I say to them, we can't let Tuskegee enslave us more than once. So here's what I recommend. One of the things that a doctor who's practicing correctly should be able to do is to say, this is what I recommend. Take this and go and let somebody else that you trust give you another opinion. And then feel free to come back. Anybody who doesn't want you to get a second opinion, the answer is, why not? What are you doing that you shouldn't be doing? So distrust is a major factor. But if you spend enough time and build a relationship, you will know. My little old ladies, and I say it affectionately because I have so many in their 70s, 80s, and 90s. 90s ladies,
great.
not one man over 70.
Wow.
Wow.
No.
Really?
All of my patients, and I
Wow.
have huge number of women in their late 80s, living independently in their 90s.
Right, and who are well.
well.
Generally well.
Is that because the
generally
men
well.
are dead?
The
Is that
men
what
are
you said?
dead.
Oh, wow. Yeah.
But
Yeah.
they
But
they
also-
practiced preventative medicine even then because they would have been 1930s,
Right.
1950s.
That's
right.
They were proactive, and you think that's why they've lived this long.
Well, women, there are many reasons why we live longer. One of them is going to the doctor when something's wrong. But I just want to say one thing about this. One of the things that people should know is if you have a symptom of something that doesn't go away in 2 weeks, I don't care if you call it a cold or a backache or a headache or
Great
this.
advice.
If it doesn't go away in 2 weeks, you should go and see somebody. And if somebody doesn't take the time with you to explain to you, first to ask you all the questions. You know, it's not just looking at it saying, They have to ask you all the right questions. If they don't have time to ask you all the right questions and then examine and then make an opinion, you need a different partner in your health care.
I think that's great advice. And you said 2 weeks, if it doesn't go away, you need to see somebody else. When we come back, we're going to get an intimate look inside one of the health clinics inside New York City. We'll be right back.